So if you suffer from temporomandibular joint disorder, which is also known as TMJ or TMD, did you know that your risk of having a migraine attack increases by 60%? That is huge. So TMJ can be difficult to treat using the conventional approach of medications and dental devices and surgery and things like that. But there is actually one simple daily exercise that you can do that can help you totally reverse TMJ. And it saved me personally from lockjaw and these bulky night guards. I hated wearing them. So that's what I want to talk about today with you. So teeth clenching and grinding and jaw pain, those all can trigger a migraine like no other, right? That just all that tension in your face. So there was a 2019 study that was published in the Journal of Pain that showed that people with migraines had a 60% increased risk of a migraine attack when they suffered from TMJ issues. So that is a huge trigger for a lot of people. And currently, the treatments that are available are things like pain relievers, anti-inflammatories, muscle relaxers, antidepressants, and a lot of those come with side effects. And then they also have, mouth devices and dental appliances that can help to shift the jaw and prevent clenching, but they're really bulky and uncomfortable, and nobody likes to wear them. And, worst of all is the corrective surgery. So some people actually have it so severely that they have to go in for surgery. I was actually looking at having to have that done as well, because my jaw was locked. I could not open it. And it wasn't until I discovered these three things that I'm going to talk to you about today that it actually saved me from surgery. And now I don't have to worry about devices. I don't actually even have to do these exercises anymore. Things have kind of resolved on their own. So that was a big step for me in dealing with my own migraines, because that was a huge trigger, was, the tension associated with that. So I want to share what those things are with you so that you can maybe start working on it on your own. All right. So number one, an anti-inflammatory diet. So this is something that you've probably already started working on since you're watching these videos and are very aware of the fact that sugar and inflammatory foods like corn and dairy and gluten and things like that can all contribute to inflammation in the body. Well, inflammation, when it comes to muscle tension, increased inflammation equals increased muscle tension. So if we were to reduce inflammation, then we get reduction in inflammation in muscle tension in our muscles. So the kind of diet that we're looking for is mainly low processed foods, whole foods, low sugar, right? Some of the basics. So a good one to start with is the Whole30, or even a modified AIP, which is an anti-inflammatory protocol diet. AIP, just as a side note, has a pretty severe grain restriction, which most people with migraines don't do well with. So I don't know that I would necessarily recommend the grain restriction part of the anti-inflammatory diet, but definitely when you choose your grains, gluten and corn should probably be eliminated, and the rest of the grains should be as organic and whole as possible. All right, number two, stress management. So again, not a surprise here, because as we deal with stress, we also improve our migraine response as well, right? But when it comes to muscle tension, with increased stress, we have increased muscle tension. And we also tend to breathe more quickly and more shallowly when we're in stress. And that reduces our oxygen intake. Oxygen helps our muscles to relax. And so if we don't have enough oxygen, our muscles can't relax. And so we get that tension. So things like breathing exercises, meditation, yoga, other stress management techniques can significantly reduce that muscle tension, improve oxygen flow, and really help with relaxation. I'll throw in on, the diet and stress management pieces. You can also look at doing some of those kind of relaxing, muscle relaxing supplements and herbs. This is kind of an off the script idea that I just had as I was talking about this, but things like magnesium can really help with muscle tension. But there's an herb called Stachy's officinalis, also known as wood betony, which acts on the musculoskeletal system and helps to reduce muscle tension. I drank that combined with lavender. That was my favorite go-to drink. Lavender, chamomile, rose petals, and Stachy's. That was my tea. I sucked down gallons of that stuff, and that really did help with some of the tension. But again, it's a medication to treat that to treat the symptom. It's not really addressing the underlying cause, right? So but just as a little side note for you, you can definitely take a look, and you can get bulk herb, mountainroseherb.com. That's where I get mine. It's all wild crafted, sustainably grown, organic So I really like them, and you can get it in bulk and just make your own. Okay. So that's just a side note there. But when it comes to the underlying conditions, the stress and the diet are going to be a huge piece to the puzzle, right? All right. So the third one, and this is the most, like, this is key for TMJ treatment. There is an exercise that you can do on a muscle in the jaw called the lateral pterygoid release. So it's almost akin to finding that muscle knot in, up here in your shoulders or wherever yours happens to be, and just pressing on it and massaging it. You can do that in your mouth. So for this part, I'm actually going to share a throwback Facebook Live video that I did several years ago that kind of explains it a little bit better, and also shows you how to do this technique. So please forgive the poor lighting, but here we go.
And I went to medical school and I learned about the muscle that closes our jaw. It's called the lateral pterygoid muscle. It actually holds the jaw closed. So it's when we are engaged in chewing, that's the muscle that's contracting. And so it wasn't until I saw an acupuncturist who introduced me to what I am about to introduce to you, and started doing it. And it literally will bring tears to your eyes. It is very, very uncomfortable. So you want to have clean hands because you're going to be putting your fingers in your mouth. This is a lot easier to be shown than it is to describe, and I can't show you because you can't see where, I'm not going to open my mouth for you. But basically what you're going to be feeling around is in the very, very back, right back in here where your jaw will open, where it hinges. Right behind that, the last tooth in there, you're going to find an area. If you keep playing around in that area, and I'm talking about on the inside of your mouth, so you're actually sticking your finger in and you're playing around behind that last molar on the bottom, there are a few different insertion points for some of the muscles in there that we're talking about. And so when you put your finger in there and you start searching around, you're going to feel some of the bone from the jaw. That's not what I'm talking about. What I'm talking about is, kind of go on the side, go on the other side, go in the back, and just kind of explore around back there. You're going to find that knot. You're going to find that super, super tender spot, just like when you're, kind of doing this and, oh yeah, there it is right there. Okay, you're going to do the same thing in your mouth, and you're going to feel where that muscle is, and you're going to press on it, and you're going to press as hard as you can, and you're going to hold it, and you're going to imagine it lengthening and relaxing, and it's going to bring tears to your eyes, and you are going to start drooling, and it's going to be uncomfortable, and that's okay. You just kind of work through it, take a break, allow it to kind of relax a little bit, do it on the other side. I actually would put both fingers on both sides of the mouth, and I would sit there and hold it every night before bed, every morning when I got up, and usually at least once or twice during the day. And I made this a regular practice, and I would say probably within 2 to 3 weeks, I noticed a significant difference in how large I could open up my mouth. And that's when I started noticing that my teeth grinding stopped. And now I don't have to do it anymore, except for during certain times when maybe I'm not as good on my diet as I should be, or my stress is a little bit higher. Then I notice, oh, I need to start working on that again. I can do it for a couple of weeks and then I'll be fine again. So it really is about kind of doing some of that body work and body care for your mouth. If you can't find what I'm talking about, if you're fishing around in there and you're like, I don't know what she's talking about, there's no place that's, super painful, then I would highly recommend either seeing a chiropractor, seeing an acupuncturist, or seeing a massage therapist who understands the lateral pterygoid and how to do the lateral pterygoid release. And that's what it's called. So you can call and you can find out from whoever you're planning on scheduling the appointment with, do you know how to do the lateral pterygoid release? Can you show me how to do it? You can also
All right, so I challenge you to try the at-home TMJ exercise as many times a day as you need it to begin reducing tension in the muscles around your jaw. That combined with the diet and the stress management can go a huge way. Like those 3 things were what I did to help my own TMJ. So it can go a long way to improving symptoms and reducing it as a migraine trigger. So if you found this video helpful, then do me a favor and give me a like, and be sure to follow my channel for notification of new videos every week.